and welcome to Talking to Doctors, a video series hosted by Cancer Voices SA, Cancer Voices South Australia. My name's Julie McCrossin, and I was treated for stage 4 oropharyngeal cancer, tonsils, tongue and throat, in 2013. And I'm pleased to be hosting this series. And basically our aim is to share practical ideas about how to have effective conversations with doctors. And it's my great pleasure to welcome Shona Edwards, who's a cancer survivor from Adelaide, treated with proton therapy, a kind of radiation therapy, in Prague in the Czech Republic in 2018. And she's involved in many things, a university student, but she's a member of the youth advisory group with the South Australian Youth Cancer Service, and she's also involved with Canteen Youth Leadership. Good on you, Shona. Look, just to begin, in a nutshell, what was the cancer that you had and the core treatment that you had? Welcome.
So I still have a grade 3 papillary meningioma at my sacrum, at the base of my spine. And I had a surgery for that in 2018. And then later that year, I had the proton beam radiation therapy. So it's still there, but it's stable. And that's where I'm at right now.
Okay. And you had a fair impact, didn't you, in terms of side effects? Can you just give people a sense of the impact it's had on you physically and then emotionally?
Sure. So it's essentially caused a minor incomplete spinal cord injury. So I have some nerve pain, chronic pain. I have trouble with my nerves in my legs. So I use a wheelchair now and I use walking sticks. And mostly it's managing chronic pain and the deconditioning from when I was bedridden through treatment. So I've had a lot of rehab and physiotherapy, and it's mostly about maintaining my condition now.
And do you mind me asking how old you are?
I'm 26 this year.
Okay.
I was 22 when I was first diagnosed in 2018.
Okay, thank you, and happy birthday for the future. Well, look, our first question in this series is, what did you find were the 2 or 3 key challenges in those critical conversations with doctors?
I think a lot of my experience in conversations with doctors is impacted by the fact that I'm a youth cancer patient. So, as I said, I was 22 when I was diagnosed. And that can be a really pivotal time for young people. It's a transitional time. You're starting your career, you're moving out of home, all those kinds of things. And I think cancer for me, it was a really disruptive force in that period. So for me, I had to move back home, not just for financial reasons, but because I needed more care. So I moved back in with my parents. And I found as the result of that, talking with doctors was a balancing act of my adulthood, if that makes sense. I wanted my parents to be present and I really depended on their guidance. But at the same time, I was an adult and I wanted to make my own decisions. So it was really important to me that doctors be able to balance having my family in the room while also addressing me and making eye contact with me, and sort of validating my adulthood in that way. I think one of the most difficult times when you're in hospital is the morning rounds, and doctors, they come around with the younger doctors and it's really alienating to be talked about like you're not in the room. And then I found that really uncomfortable and I really needed someone to ground me after that. And I also had my parents in the room. So it's sort of, there's a lot of egos in the room, if that makes sense. I think that can be a juggling act for how to talk to the doctors in those moments.
Let's deal with those 2 issues that you've raised, and then we might go on to something else and go to the question of what advice you would give to other young cancer patients faced with that challenge. So the first is that sense of you become dependent again on your parents and you both want their guidance, but on the other hand, you are a young adult. So what's your tip to the young cancer patient, and I guess also to the doctors in that situation, about how to handle it?
Yeah, I think that grounding is really important. So having one doctor approach you either before or after those rounds can really make a difference. And it doesn't make me feel so much like you're an interesting object that's being studied. I think in terms of advice for the patients themselves, I think it's really important to build confidence with how you deal with the doctors. And sometimes that's about knowing the information about your own case so you can ask questions and interact confidently. And there are a few different ways you can build that, but I think it's sort of cultivating your adulthood when you're especially vulnerable in times of crisis, while also understanding that you're going to be sensitive there and you're going to need a lot of guidance. I think, the time before and after rounds can be really pivotal.
So in a nutshell, you're saying try and do some research about your treatment or what's going to happen next, so you've got some good questions ready. Is that a key suggestion? But you're also saying to nurture your own confidence. How do you do that? What sort of things?
So I really recommend patients have a notebook with them, and you take notes and listen when they do those rounds. And it's sort of, on one level, it helps you get information about your own case, but it also helps you feel like you're doing something proactive because you're listening and you're taking notes. And when you're in treatment, you see so many specialists and you can really be passed around and see a lot of different people. It can be really overwhelming. So I think the notebook is not just about keeping track of the information. It's about feeling like you are doing something for your own case and that you're sort of on the same team as the doctors, if that makes sense. And I think the building confidence, it's about doing the research beforehand, yes, but I think it's about trusting yourself and really staying in tune with your own body and knowing your own case from yourself, not from outsiders telling you what's going on with you. So I think cultivating a space for you to reflect on your situation and how you feel, and that can really inform your confidence and inform the doctors.
In your opening comments, you mentioned the importance for doctors to give you eye contact. And you also mentioned that the period after, particularly a ward round, when you're in that hospital setting, is critical in terms of trying to have contact with one doctor. So let's focus in hard on the doctors. If you could say, what would help you as a patient if they did this? What are the 2 or 3 things you want them to do, particularly as a young patient?
Sort of, like I said, it's a bit of a balancing act, especially if you've got many family members in the room, that they have to cater to your family and cater to you at the same time. But I found if they privileged me and spoke to me, even if a family member asks a question, they answer it to me. I found that made a big difference. And it stopped me feeling like an object that was being talked about. I also really benefited from having access to the youth cancer service staff. And they were sort of a touchstone for me before and after those kind of appointments or contact with the doctors. And it's just someone to debrief with. And then I can go over what the doctor said to me or report it back to them and sort of understand it better for myself. And, when you explain something, you kind of observe yourself as well as that reflection again. So I think sometimes doctors can be really busy and they're trying to save your life. I understand they're busy. So it can help to have other professionals enter that space where they can be that grounding influence. And I think the youth cancer service really was that for me.
That's interesting, because obviously I was in my 50s when I had my cancer treatment, but there was a nurse coordinator in the team who was my primary point of contact. So that's as an older patient, and I was able to use her to check if I understood and so on. But so if you're a young person, ask, is there a young cancer team member or someone who can assist you to both prepare for the conversation with doctors but also debrief?
Yeah, I found sometimes that's a social worker. I actually found probably my first point of contact was my physiotherapist or the exercise physiologist through the youth cancer service. And that was the person who saw me most regularly. So I think that person who's a professional, who's a health professional, but who can be more of a contact for me to just unload and then reflect and then sort of reevaluate. So I know what questions to ask next time too. It helps me better prepare for those encounters with doctors.
That's an important point, because in Australia, we should be lucky enough to have a multidisciplinary team in most situations. And allied health people can be critical both during treatment but very much in recovery. So they can be another resource. So as another tip, if you've got rapport with someone, and they tend to have longer appointments, so you've got more time, make sure you draw on an allied health person. Is there another challenge or tip that you'd like to raise?
Yeah, so I think, again, this relates to being a young person with cancer. Sometimes there are conversations with doctors that you want privacy from your family with, right? So it's hard as a patient, especially a young patient, to know how to draw that line or how to ask your parents to leave the room if you do want to have that conversation. So it might be a conversation about sexual health, or for me, maybe fertility preservation. And I really appreciated when doctors took the step to ask if I wanted to speak privately before the end of the appointment, because I didn't know how to ask my family to leave without offending them. And when you depend on your family so much during a time of crisis, you're blurring the lines of identity between you and your family and the boundaries between you that existed before the crisis. So it can be really hard to reestablish those boundaries and identity. Sometimes you do need to have conversations privately with your doctor.
That's so interesting, Shona, because I think you said you were 22 when you were being treated, and that's obviously a young adult, isn't it? And yet these issues come up for young people 13, 14, 15, but you're saying even in your early 20s. So it just shows you, I mean, again, as a cancer patient myself, one does become physically, emotionally dependent, even help to go to the bathroom or to cook food, all the basics. So there's a kind of regression that you're more at risk of, is what you're saying. When you're young.
I think especially it's really hard to reestablish those boundaries afterwards. So I think if you're aware of them going in, that might be something that you need to be aware of identity kind of blurs together, especially when you've got close care between you and a family member. You might not even know consciously that you want to have a conversation privately without them. So I think the doctor's prompting that can make you think about it and give you the option. And that's the most important thing.
I've got one more question for you, but is there another issue you want to raise during this conversation?
I do. One piece of advice I want to give cancer patients is really to be honest when you're doubtful or skeptical about something. I think telling the doctors when you are unsure or you don't understand something is as important as telling them your symptoms. Especially, if you get given exercises or a diet to follow and you don't follow it, you need to tell them that so that they can make the best informed recommendations for you. And that includes things like financial trouble, right? If you're not honest with the doctors and trusting and giving them information, they can miss vital elements of your case and then not be able to give you the best advice. So, for example, I had some delay in getting on the National Disability Insurance Scheme. And so I wasn't able to afford the multiple times a week I was recommended to see physiotherapy. And if I hadn't been upfront about what I could and couldn't afford, then my doctors and my allied health team wouldn't have known to send me to somewhere where I could be involved in a trial and I could have access for 6 weeks to a physiotherapist. And that was the difference between me being bedridden and me being able to learn to walk again. So I think there are a bunch of programs that might be available, but doctors can't recommend them to you unless they know your full situation. And I think part of the hesitation with being fully honest about your situation or whether you doubt something with patients can be because you don't want to be seen as a problem patient or disruptive or a troublemaker. And I think one of the hesitancies there might be you think doctors are very busy and you don't want to take up their time, or perhaps you don't be fully honest about the pain you're in because you don't want to seem like you're drug seeking. But if you're not fully honest with the doctors, then they can't provide the best advice for you. And it's really hard to be courageous and honest with doctors sometimes, but it's so important.
Look, thank you. Our time is nearly up, but I just want to say you did have access to a quite remarkable bit of technology as part of your physiotherapy treatment, and we'll show some images of that. And we will put on the Cancer Voices SA website another interview that I've done with Shona, where she goes into greater detail into the actual treatment side of her care. But just finally, when we've talked before about having effective conversations with doctors, you've talked about power. And just in a nutshell, what is the challenge of power, and what's your key tip for managing that as a patient?
Yeah. When I talk about this with patients and doctors, I talk about it like there's a secret code or a secret language that you have to learn in order to talk about your own condition. And I think that's a result of doctors are highly trained and they've spent years learning how to talk about medical issues, but we don't have that training. So we really have to pick up the language that's used and the terminology ad hoc. We have to pick it up on the way. And that can be really frustrating. Because it's almost like if you use the right words, you suddenly get access to services. And I think that's an element of the power doctors have, this training, that they can sometimes forget or overlook, that we don't have that same insider knowledge, and that we really need patience and understanding to be taught those things to be able to advocate effectively for ourselves.
That's a challenging comment from you, Shona, because you're a university student, you're doing classics at the University of Adelaide, you're a bright girl, young woman, and yet you feel that. And I know some will be saying, oh, you don't have to learn the language of the medical profession, but you feel to have to get some sort of equity in the power balance, learning some of the lingo helps.
Yeah, it does. And the reality is, as patients, we have to deal with Centrelink, we have to deal with NDIS. So we do have to learn the terms that are the key that opens the door. And that can be really effective. It doesn't mean we have to, it just means there's advantage. And really, if we want real equity, there shouldn't be that gap between knowing and not knowing.
As always, Shona, it was a tremendous pleasure talking to you. Thank you very much.
Thank you.